Hello, everyone. Thank you for joining today's overview of virtual groups for Year 3 of the Quality Payment Program webinar. The purpose of this webinar is to provide information about participation as a virtual group in Year 3 of the Quality Payment Program. Now, I will turn it over to Adam Richards, Health Insurance Specialist in the Center for Clinical Standards at Quality at CMS. Please go ahead.
All right, fantastic, and thank you, and good afternoon, everyone. Thank you for joining us for what I anticipate will be a very informative discussion on our virtual groups participation option under the Merit-Based Incentive Payment System, or what we affectionately refer to as MIPS. I'm excited to be joined today by Lisa Marie Gomez, our resident expert on virtual groups, among many other key components of the Quality Payment Program. Now, I know we've had a few events last year on virtual groups, so we're hoping that this will serve as a good refresher to get clinicians once again thinking about this option as we inch closer to the beginning of the election period, which Lisa Marie will discuss shortly. We've also recently released the 2019 Virtual Groups Toolkit. Again, we'll talk a little bit about that later on, but it really does have some fantastic resources, including the Virtual Groups Agreement Checklist, our agreement templates, the election process fact sheets, and the general virtual groups fact sheet. And really, this is all in an effort to help clinicians and groups get started with the process. So this toolkit is available within the Quality Payment Program resource page on cms.gov. We're going to talk about a number of components today, so there's a lot of really great information available in that Quality Payment Program resource page. So if you do have any additional questions on various aspects of the Quality Payment Program, I highly recommend taking a look at that library. Of course, we always have our Quality Payment Program Service Center available to help answer your questions. Also, a bit of a sidebar here, but we did announce the release of this Virtual Groups Toolkit via the Quality Payment Program listserv. I highly encourage each of you, if you have not done so already, to sign up for the listserv at qpp.cms.gov. All you have to do is go to the main page, scroll down, and enter your email address. And this will really keep you up to date on all things QPP, not just virtual groups. It really is the entirety of the program. It's an incredibly valuable resource, but again, as we get closer to the election process, to our election period kicking off, it's certainly valuable to have to be signed up for that listserv for important virtual group information. We anticipate you'll be learning quite a bit today. I will say that since we've been seeing a good mix of newer learners with some of our regular participants who have joined our webinars so far this year, we're going to do our best to provide as much context as we can. I think this ultimately helps all of us conceptualize why we are here today, talking about virtual groups. One ask from us as we bring you all up to speed on virtual groups is to really help us spread awareness about this option. This is a great and unique opportunity for participating in MIPS. We're thrilled that so many of you could join us here today, but we want to keep talking about virtual groups, and we want to keep spreading awareness of this option for MIPS. So if you can help us with that, we would greatly appreciate it. So I'm going to charge forward to slide 3. Just to talk a little bit about what we'll cover today as far as virtual groups. We'll give you a nice overview, talk a little bit about participating as a virtual group in MIPS. Then we'll start getting into more of the technical components, if you will. So we'll start looking at, I guess before we get into the technical components, we'll take a look at the application of our group-related policies to virtual groups. Then we'll get into the technical components where we'll start talking about the virtual group election process, some of our formal agreements that we have, and then we'll take a look at the virtual group resources. Also talk a little bit about technical assistance, because that is a really important initiative for those who are interested in participating in a virtual group. They can certainly help get you started and get you through the process. And then, of course, as our time allows, as we do with all of our webinars, we'll certainly allow for a question and answer session to help address some of the questions that you have on virtual groups. So with that, I'm going to turn it over to Lisa Marie to walk you all through virtual groups.
Great. Thank you, Adam. So on slide 4, as Adam noted, virtual groups is a new option in which whether you're a clinician or a group are able to participate in MIPS. So, starting with this year, 2018, there are 3 ways in which you can participate, which is as an individual, as a group or as a virtual group. And so today we're going to discuss, for year 3, which is 2019, participation as a virtual group. So next slide, please. So to begin the discussion today, I want to just dive into what is actually a virtual group. And a virtual group is defined as a combination of 2 or more TINs assigned to 1 or more solo practitioners or to 1 or more groups consisting of 10 or fewer clinicians, or both, that elect to form a virtual group for a performance year. So in this case, it would be for 2019. In order for a virtual group to form, it must have at least 2 TINs, an entire TIN that elects to form a virtual group. And they must participate in that virtual group. And a virtual group would include, MIPS-eligible clinicians, clinicians not eligible for MIPS, and clinicians who may be participating in both a virtual group and a MIPS APM or an advanced APM. I just want to note that we consider a group to be an entire single TIN that elects to participate in MIPS as part of a virtual group. So when we think about, again, like virtual groups, it's solo practitioners and groups, and entire groups have to participate as part of a virtual group. So now we're going to get on to the next slide. And on this slide, I'm going to get into more details about, again, who can participate in a virtual group. So, who can participate in a virtual group? So it's solo practitioners and groups with 10 or fewer clinicians who are able to form virtual groups. In order for a solo practitioner to be able to be eligible to participate in MIPS as part of a virtual group, a solo practitioner must be a MIPS-eligible clinician, they must exceed the low-volume threshold, and they cannot be a new Medicare-enrolled MIPS-eligible clinician, or a qualifying APM participant, or a partial QP participant choosing not to participate in MIPS. So it's very specific in terms of a solo practitioner being eligible to participate and be part of a virtual group. So now let's go on to groups. So in order for a group to be eligible to participate in MIPS as part of a virtual group, a group must have 10 or fewer clinicians under its TIN and must exceed the low volume threshold at the group level. I just want to note that TIN size is based on the total number of clinicians, or NPIs, billing under a TIN, which includes, again, MIPS-eligible clinicians, clinicians who do not meet the definition of a MIPS-eligible clinician, and or those who are excluded from MIPS participation based on one of the exclusions, such as what I had just mentioned before about, let's say, being a new Medicare-enrolled MIPS-eligible clinician, or a clinician has a QP status, or a clinician who has partial QP status choosing not to participate in MIPS. So again, when we think about groups participating, they're going to have a mixture of clinicians, those who are eligible for MIPS and those who are not. And so we just want to make it clear that, again, when we think about a group and we think about the number of clinicians, it's total TIN size. And it's all the clinicians within that particular group. All right, so now let's go on to the next slide. So we're going to continue to discuss who can participate in a virtual group. And so here on this slide, we outline that if you're a solo practitioner or a group, you can only participate in one virtual group during a performance period. Also, there are no limits as to the number of solo practitioners and groups able to form or join a virtual group. Also, I just want to note that if a group chooses to join a virtual group, all of the clinicians are part of the virtual group. So you're probably going to hear us emphasize that over and over, that every single individual who is part of a group is actually a member of a virtual group. And there's also just one thing I want to also discuss here, which talks about how do virtual groups decide who to include. And what we have established in our policies is that we want to provide virtual groups with as much flexibility as possible. So virtual groups have the flexibility to determine their own composition. There are not any restrictions on virtual group composition based on location, specialty, or any other factor. So, right now we really want virtual groups to determine, what is their best composition to allow them to be able to successfully, meet the requirements of the program. And so we have not placed any limits, and right now they can determine their own composition. All right, let's get on to the next slide. We often get the question, why should, a TIN or a solo practitioner or a group join a virtual group? Like, what is the benefit? The formation of virtual groups, it provides a comprehensive measurement of performance. It provides shared responsibility, and it provides an opportunity to effectively and efficiently coordinate resources to achieve, requirements under each performance category. So we know that, small practices, because like solo practitioners and, the small groups are considered small practices. And oftentimes they may have limited resources and may have, various challenges that may differ from larger practices. And so joining or forming a virtual group, as we, identify that it can enable, groups within a virtual group to have shared responsibility. It also provides them to be able to achieve and meet requirements. And also, we want to note that when a solo practitioner or group, chooses to elect and join together, they can potentially increase their performance under MIPS, and specifically under each performance category. So we will go on to the next slide, please. All right, now we're going to discuss, participating as a virtual group in MIPS. So we'll go on to slide 10. So participating as a virtual group in MIPS. So, virtual groups are required to aggregate their data across all TINs within the virtual group for all performance categories. Each member of a virtual group will have their performance assessed and scored at the virtual group level across all 4 performance categories. A whole TIN participates in a virtual group, meaning that each clinician under the TIN is a member of the virtual group. So each clinician within the virtual group will have a final score based on the virtual group's performance. But only clinicians who are considered to be eligible for MIPS would receive a MIPS payment adjustment. Any MIPS eligible clinician who is part of, let's say, a TIN participating in a virtual group, let's say who is also participating in a MIPS APM or advanced APM under the APM scoring standard, will not earn a MIPS payment adjustment based on the virtual group's final score, but would earn a MIPS payment adjustment or earn a payment adjustment based on the APM scoring standard. So in the case that a MIPS eligible clinician is part of a virtual group, but also participating in a MIPS APM or advanced APM, they will receive a virtual group score, but their final score will be based on their APM scoring standard. And they will also get a score for whatever model that they're participating in. All right, so now we're going to go on to the next slide, which is slide 11, and it's going to introduce what we consider, the application of group-related policies to virtual groups. So next slide, please, onto slide 12. So generally, group-related policies that have been established previously apply to virtual groups, and any policies that are established in future rulemaking will also apply to virtual groups unless otherwise specified. So the submission mechanisms that are available to groups are also available to virtual groups. Similar to groups, virtual groups are able to utilize multiple submission mechanisms and determine which one is best for their virtual group, similar as to groups for whatever performance category. And also, I just want to note that the measure reporting requirements applicable to groups are also generally applicable to virtual groups. And I'm just going to go over some nuances in which the policies for groups and virtual groups differ. So we note that requirements for calculating measures and activities when reporting via a QCDR, qualified registry, EHR, or attestation as I said, differ in their application to virtual groups. So specifically, these requirements apply cumulatively across TINs within a virtual group. Thus, virtual groups will aggregate data for each MPI under each TIN within the virtual group by adding together the numerators and denominators and then cumulatively to collate and to report one measure ratio at the virtual group level. So again, this is aggregated at the virtual group level in which every NPI information or data is aggregated to get that overall virtual group level measurement. Next slide, please. Now I'm going to go and discuss, data submission mechanisms. So the data submission criteria to groups are also generally applicable to virtual groups. However, we note that data completeness and sampling requirements for the CMS web interface and CAHPS survey differ in their application of virtual groups. So specifically, data completeness for virtual groups applies cumulatively across all TINs within a virtual group. So thus, we note that there may be a case when a virtual group has one TIN that falls below, let's say, the data completeness threshold, which is acceptable, which is an acceptable case as long as the virtual group cumulatively exceeds, the data completeness threshold. So in regard to the CMS web interface and CAHPS survey, sampling requirements, pertaining to Medicare Part B patients with respect to all TINs within the virtual group, where the sampling methodology would be conducted for each TIN within the virtual group and then cumulatively aggregated across the virtual group. A virtual group would need, meet beneficiary sampling thresholds cumulatively as a virtual group in order to be able to meet the requirements for the CMS web interface or to be able to administer the CAHPS permit survey. All right, we're going to get into the next slide, slide 14. So on this slide specifically differentiates policies that differ from virtual groups at a larger scale. So the three areas in which group-related policies differ from virtual groups relate to non-patient-facing status, rural area and health professional shortage area status, and small practice status. So with regard to non-patient-facing status, a virtual group is considered to be non-patient-facing if more than 75% of the NPI's billing under the virtual group's TINs meet the definition of a non-patient-facing individual MIPS-eligible clinician during the non-patient-facing determinations period. Virtual groups determined to be non-patient-facing, have the option to have their promoting interoperability performance category automatically reweighed to 0. So when we think about rural and health professional shortage area status, a virtual group will be designated as a rural area or health professional shortage area practice if more than 75% of NPIs billing under the virtual group's TINs are designated in a zip code as a rural area or health professional shortage area. Now with regard to small practice status, a virtual group will have a small practice status if the virtual group has 15 or fewer clinicians. So the small practice status is applied based on the collective entity as a whole and not based on the small practice status of each TIN within a virtual group. So if a virtual group has 16 or more clinicians, it would not be considered to have a small practice status as a collective whole or as a virtual group. All right, next slide, please. So now I'm just going to go into some of the nuances with regard to scoring for virtual groups. So now we'll go to slide 16, which further describes some of those items. So as I previously mentioned, I noted that virtual groups are required to aggregate their data across all TINs within the virtual group for all performance categories. And as I noted earlier, we also said that each member of a virtual group will have their performance assessed and scored at the virtual group level across all performance categories. So a whole TIN participates in a virtual group, and as we noted previously, each NPI under the TIN is a member of the virtual group. And the reason why we're going over this is because we just want to iterate that, virtual group scoring and participation is at the virtual group level, which means it's every single NPI within a virtual group. All right, next slide, please. So as we previously noted, we just want to iterate again that each NPI or each clinician within a virtual group will receive a score based on the virtual group's performance. And again, only clinicians who are eligible for MIPS will receive a payment adjustment. And so again, this slide just iterates, what would happen in the event that if a clinician is not only part of a virtual group, but also part of a MIPS APM or an advanced APM. And so these, so there are specific nuances that do occur in how clinicians would either be scored and how a payment adjustment would be applied to. I also just actually want to give an example and outline, a situation in which, let's say there is a clinician associated with multiple TINs. So for example, if a clinician is part of TIN A, which is participating in a virtual group, and is a part of TIN B, which is participating in MIPS at the group level. So in general, this clinician will be assessed and scored under each TIN association during the performance period, and subject to MIPS payment adjustment for each TIN MPI combination. So under TIN A, this clinician's data would be included in the virtual group's aggregated data and would receive a final score based on the performance of the virtual group and subject to the MIPS payment adjustment. So under TIN B, this clinician would be participating in MIPS as part of a group and would receive a final score based on performance of TIN B and subject to the MIPS payment adjustment. So we recognize that there could be different scenarios where it could just be one clinician only participating in a virtual group. There could also be a situation where a clinician may be associated with multiple TINs. And so we just wanted to give an example of what it would look like when someone is part of a virtual group, but they're also part of a different TIN, and that TIN is participating differently in MIPS. So in this particular example I gave you, they're participating as a group. All right, let's go on to the next slide, slide 18. So now we're going to get into virtual group election period for 2019. And actually, let's go on to the next slide, slide 19. So as we've noted that this particular presentation is with regard to participating in MIPS, starting with the 2019 performance period. So for the 2019 performance period, an election, whether it's sole practitioner or groups making an election to form a virtual group, there is no actual election process that the virtual group would need to participate in. So for this 2019 performance period, a virtual group election period begins October 1st of 2018 and will close December 1st or December 31st of 2018. And so we just wanted to emphasize that in order for a solo practitioner or a group to participate in MIPS as a virtual group, an election must be made prior to the start of the performance period and cannot be changed once the performance period begins. So the reason why we're providing all this information about virtual groups is because if you want to participate in MIPS for, let's say, the 2019 performance period, an election has to be made now in 2018. So you'll have a 3-month time frame to make an election. And so an election, if let's say you make an election, whether it's the month of October or the month of November of this year, you can change your election at any point in time before the virtual group election period ends. So if you decide maybe you don't want to form a virtual group after you submitted, you can cancel that registration by December 31st of 2018. All right, next slide, please. So on this slide, I'm going to talk about what we describe as a 2-stage virtual group election process. So there's stage 1 and stage 2. So we've established a specific 2-stage process for virtual groups. And under stage 1, we consider this to be optional. So solo practitioners or groups with 10 or fewer clinicians can contact their local quality payment program technical assistance organization to see if they meet certain criteria to be able to join or form a virtual group prior to submitting an election. So, your TA representative can provide information regarding virtual groups as to help you determine whether or not you want to join a virtual group. Let's say before you actually make any formal written agreements, send in a virtual group election, or that you budget resources to a virtual group. So that's within stage 1. It can help you assess and determine information, let's say before submitting an election. In stage 2, for groups that don't participate, in stage 1 of the election process, CMS, we will determine the eligibility of any TIN that is part of virtual group election, once that election is submitted. And we just want to note that, all elections, at least for the 2019 performance period, the election is, to CMS via email. Next slide, please. So now I'm going to continue discussing, stage 2 of the election process. So as part of stage 2, each virtual group must have a formal written agreement between each fellow practitioner and group that composes a virtual group before an election is made. So a formal written agreement does not have to be submitted to CMS, but it has to be already established between each entity within the virtual group, which would also include each clinician within the virtual group. Also, a virtual group must name an official virtual group representative who is responsible for submitting an election on behalf of the virtual group to CMS. And as I noted, for this 2019 performance period, a virtual group election has to be submitted to CMS via email. And the email specific address is MIPS_virtualgroups@cms.hhs.gov. And each virtual group representative must submit a virtual group selection prior to the start of the 2019 performance period, which is by December 31st of 2018. So again, an election has to be made before 2019 starts, and the deadline is December 31st of 2018. And I just want to note that the virtual group representative has a very specific function and role within the virtual group, and we as CMS will communicate to the virtual group via the virtual group representative. Next slide, please. So also part of the stage 2 virtual group election process. So let's say once a virtual group makes their election and CMS, we conduct our eligibility determination, we will issue a virtual group, an actual virtual group identifier. We will submit or issue that virtual group identifier to the virtual group representative, and that will also determine at that point in time that a virtual group is considered an official virtual group. So each member of the virtual group will have and actually be identified with a unique particular identifier. So how we will identify members of virtual group will be based on 3 factors: the virtual group identifier, the TIN, and the MPI. And so any information that, let's say, changes within a virtual group, let's say the number of clinicians, or let's say clinicians leave a virtual, let's say a TIN within a virtual group, or there's any change, it's important that the virtual group representative submit any information to CMS that specifies any changes to the composition of the virtual group, because we at CMS identify each member of virtual group. So when we're thinking about issuing virtual group scores, or who has virtual final score and who should receive or not receive a payment adjustment, we need to know at all times what that virtual group composition is, or in terms of all the NPIs. So it's critical that at any point in time that there is a change, that the virtual group representative submit that information to CMS. And that information doesn't have to be submitted every time there is a change, but at least once before the submission period starts or the reporting period begins. So we want to make sure that we have all the accurate information relative to a virtual group. All right, next slide, please. So this is actually, I'm going to talk about a little bit more about the virtual group election process, specifically stage 2, and about our eligibility determinations when we think about how virtual groups are determined to be eligible to participate in a virtual group. So when we think about virtual groups and eligibility, we think about group size and low volume threshold. And these are the two criteria that we look at in terms of being eligible for virtual group participation. So for virtual group eligibility, the low volume threshold will be determined for each TIN within the virtual group and not for the overall virtual group. And as I noted, also TIN size or group size. So group size may change, and we recognize that may happen over time, but we want to note that TIN size determinations that are made for virtual group eligibility during stage 2 of the election process will remain valid for the entire performance year. So we recognize that TIN sizes may change, but once eligibility is determined during the stage 2 process, that will remain. So even if, let's say your TIN that's participating in a virtual group, let's say your TIN size exceeds 10, that's okay because eligibility was already determined and your TIN was already determined eligible to participate. So one thing I do want to highlight is that during the performance period, a TIN cannot be added or removed from a virtual group. So during the performance period, we recognize there may be cases in which, within a virtual group where, let's say, a TIN is acquired or merged with another TIN, or a TIN is no longer operating. Let's say a group practice closes during the performance period. Such solo practitioner or group's performance data would continue to be attributed to the virtual group. The remaining parties of the virtual group would continue to be part of the virtual group even if one solo practitioner or group remains. We consider a TIN that is acquired or merged with another TIN or no longer operating as a TIN, to remain a TIN and still operating under, part of the virtual group. So we just want to highlight, how different dynamics that can change, let's say, during a performance year, how that would look in terms of participation as part of a virtual group. And we recognize that there's different circumstances and situations that may occur where that composition of the virtual group may change a bit. And so we wanted to highlight, what those changes would be. All right, next slide, please. So one thing I want to go over are some elements and items, actually on this slide and the next slide. I want to outline items that solo practitioners and groups may want to consider before submitting a virtual group election. So the items include, how would the virtual group meet the requirements for each performance category? Are there operational elements that the virtual group would need to address in order to meet the reporting requirements for each performance category? Which measures and activities would the virtual group report? How would the virtual group collect and aggregate its data across the TINs within the virtual group? Which submission mechanisms would the virtual group want to use? What health IT is used by each TIN within the virtual group? Considering what those are. So these are just some examples on this slide. And actually, let's go on to the next slide to discuss other elements that let's say solo practitioners or groups should consider. So continuing on, what are the resources and needs of a virtual group? How would the virtual group identify and share best practices used within TINs, participating as the virtual group? What processes, workflows, and other tools would need to be established for the virtual group to prepare for reporting? How would each TIN within the virtual group have a shared responsibility in decision making? Has the virtual group considered the development of a strategic plan and timeline? Has the virtual group determined if, how, and when TINs within the virtual group would be able to view, let's say, quality data and or, let's say, pertaining to other specific performance categories in which such permissibility could be established as a provision under the virtual group agreement. So these are just some items that we have identified that entities that are considering wanting to form a virtual group, that they should have a conversation with, let's say, other TINs that they're thinking about joining with, have a conversation about all these particular elements or items to see how, the actual formation in the virtual group would actually function and do reporting and meet the requirements. This is really, really critical. So now let's go on to slide 26, and on the next couple of slides, we're going to discuss virtual group agreements. So let's go on and move actually on to slide 27. So a virtual group. So to support the process of virtual groups, we've established a requirement requiring virtual groups to have formal agreements. So virtual groups must have a formal written agreement between each solo practitioner and group that composes a virtual group. And this is to ensure that the requirements and expectations of participation in MIPS are clearly articulated, understood, and agreed upon. We want to make sure that each individual within the virtual group is aware of their participation and their shared responsibility. As part of the virtual group process, each virtual group official representative will confirm, through their election, that an agreement for at least one performance period has been established between solo practitioners and groups that compose the virtual group. And to support this process, we've created a virtual group model agreement to serve as a template that virtual groups could use. And we want to note that, with this template, other elements or provisions can be added, and it's again based on the needs of the virtual group. And as Adam mentioned earlier, we published on our website a virtual group toolkit for the 2019 performance period. And in that toolkit, there's the model template, and it includes checklists, and it includes a lot of materials that can help you identify what you need to do for your agreement. So next slide, please. So on this slide and the next slide, these outline the 9 provisions that need to be included in a virtual group agreement. Also, I just want to note that if an MPI joins or leaves a TIN, or a change is made to a TIN that impacts the agreement itself, let's say there's a legal business name change during the applicable performance year, which in this case would be 2019, a virtual group has to update the agreement and send the changes to the Quality Payment Program Service Center. And so these changes, again, is to ensure that we know who is part of the virtual group, and that we're also aware that every member of the virtual group is aware of their participation, and everyone has agreed to these written formal agreements. So you just want to ensure that throughout the process of, let's say, during a performance year, everything is updated and includes and recognizes all individuals, and everyone has agreed to these formal agreements. I just want to note that, again, the virtual group representative has a critical role. And so the virtual group representative, would be the one to communicate this information to CMS. So again, next slide, this just continues the provisions that would have to be included in a virtual group agreement. And again, a virtual group can include any other provisions that they would want to include, or they can just keep these 9 provisions. But we just want, to give virtual groups the ability to add any other provisions that may meet the needs of the virtual group. So next slide, which is slide 30, I'm just going to briefly discuss, virtual group resources. And Adam had mentioned this at the beginning of the presentation. There is a virtual group toolkit, and it is currently available. And the toolkit provides just a wealth of information that is extremely, extremely helpful. And it outlines virtual group agreement checklist, virtual group agreement template. It also includes information about the virtual group election process. And it also provides just general information about virtual group participation, because there's a lot of nuances and a lot of details about virtual group participation, but all the information is within the toolkit. So we really encourage you to check out the 2019 virtual group toolkit, because it has all the information that you need and all examples and templates that will just be so useful to you. All right, right now I'm going to turn the presentation over to Adam. And so Adam, take it away.
All right. Well, thank you, Lisa Marie. We covered quite a bit of territory, so hope everyone was taking copious notes. We do just want to talk a little bit about the help and support. I mentioned this earlier, and certainly Lisa Marie talked about it, having technical assistance as part of the election process. So if we go to the next slide. Again, as Lisa Marie discussed earlier, we do have technical assistance available to help clinicians and groups get started with the virtual group process. Excuse me, whether it's through a determination or help piecing together an application, whatever it may be, these groups are certainly available to help. And the best part about this is that they're all available to help at absolutely no cost to clinicians. So just to kind of quickly go through this infographic, again, I'm sure some of you have seen this, but others, this may be a new infographic. We do have our Small Underserved and Rural Support Initiative for clinicians who are in smaller practices, as we've been talking about all day, those with 15 or fewer eligible clinicians. We have, for our larger practices, I think we'll kind of go down to the bottom left-hand quadrant here, our quality innovation networks and quality improvement organizations. They're really meant to support organizations greater than 15, so the 16 or more practices, those larger size practices. And then, of course, we have the Transforming Clinical Practice Initiative, what we call TCPI, and the Practice Transformation Networks. And this initiative is really meant for both small and large practices who are interested in practice transformation and really beginning to move along the spectrum of toward that value-based system of care. It's a great option for those who are interested in moving toward an alternative payment model or an advanced alternative payment model, which isn't something we talked about too much today. But all of these groups are available to help. So they can give you just the general quality payment program support, but also the more specific virtual group support that clinicians may need as they're starting the selection process and starting to get the paperwork together, or, as I mentioned earlier, just trying to determine if they could even participate as a virtual group. Of course, I'd be remiss if I didn't mention that we do have our Quality Payment Program Service Center, always available to answer your questions. Again, for virtual group questions as well as anything quality payment program specific. I think that information is listed on the slide. We have both a number and an email address, so you can call or write us. And of course, always encourage folks to check out our quality payment program website, qpp.cms.gov. We have a lot of really great information, and again, that is the one place to go if you do want to connect with us and join our listserv for some really great updates. Okay, so at this point, I think we're going to charge along. We have a couple minutes remaining as part of our webinar, so we're going to get into the Q&A session. So if we can go one more slide, and I'm going to turn it over to the operator to just remind everyone how to get on the line.
We are now going to start the Q&A portion of the webinar. You can ask a question via chat or via phone. To ask a question via phone, you will need to dial in at 1-866-452-7887. The number again, 1-866-452-7887. If prompted, please provide the ID number 217-6554. Once you have joined the conference, please press star 1 on your telephone keypad to ask a question. Again, that's star 1 to ask your question.
Okay, fantastic. Thank you. So we'll give you all 30 seconds or so to dial in if you'd like to ask us a question. I know we saw a couple questions pop up in the Q&A. We'll try to get to those too as well. I know we can also kind of answer them as we're going along. Again, I do just want to remind everyone about just another reminder. I know I sound like a broken record, but certainly sign up for the Quality Payment Program listserv. It is a valuable resource. Again, we did release the 2019 Virtual Groups Toolkit last week, and that was announced through the listserv, and certainly any additional information related to virtual groups will go out through that listserv, so very important to sign up. Okay, so I'm going to check in. Do we have a caller on the line?
We have a question from Donna Cohen.
Hi, Donna.
Hi. So in talking to clinicians across the states, one of the main things that they ask is, what is the advantage of me participating in a virtual group versus as an individual if I am a high-performing provider?
So this is Lisa Marie. So I just want to highlight when you're talking about, let's say, like a clinician. So the only individuals or entities that can participate is a solo practitioner in which under their 10 there's only one clinician or a group of 10 or fewer. So there are actually a couple of reasons. So we recognize that there are, small practices, that they're a solo practitioner or a group of 10 or fewer clinicians, they have limited resources. So you can actually join together and bring resources, have a shared responsibility. Also, there is a possibility that when you do join together with the other 10s, you could increase potentially your score for each performance category, your overarching, your final score, and impact your payment adjustment, let's say a higher payment adjustment. So there are advantages to coming together. We also know that, let's say for example, when we think about like data completeness, or we think about having enough, let's say, data to be able to accurately report. So when you have more clinicians joining together, your data can be measured like more accurately and effectively. And so by joining together and having more clinicians, you're able to do that. So those are some of the benefits of forming virtual groups. So those are the ones that we've identified, and the others have actually specified too for those who are interested that allows them to be able to do that.
Thank you very much.
Okay, thank you. Do we have another call?
Your next question is from Seema Ratour.
Hello. Hello?
Hi, Seema.
Yes, so I have a few questions. Question number one, if a group joins a virtual group, and if they also want to support the MIPS on their own group, can they do that?
Yes, let me answer that question. So if a 10 or a group is part of a virtual group, and so their data is included as part of the virtual group data submission, but let's say they also submit data as a group. So CMS, we will only score that group based on the information that was submitted as a virtual group. And it's because statute specifically requires that if you are in a virtual group, you must be assessed and scored as part of that virtual group.
Okay.
So even if you, let's say, because if you submit it, you can submit it, but CMS, we're not going to score it. We won't even look at it. Yeah.
Okay. I have another question. Earlier you mentioned that the advantage of participating in a group for solo practitioner is that it helps with data completeness. But my understanding is that data completeness is on a provider depending on how many patients they see, right? So
right.
I don't.
So with like data completeness, I'll just give you an example with. So with data completeness, it is based on like each individual, and so like on the PowerPoint, I don't know exactly what slide it is, but in there it outlines that like if let's say there is a 10 or let's say a solo practitioner or a clinician that doesn't meet the criteria, that's okay as long as collectively the virtual group meets the data completeness criteria.
I understand. No, I understand. My question is that like when you were talking earlier to the caller saying that the advantage of joining a virtual group is that it can help provider with their data looking better and with their data completeness, which is 60%. And what I understand is as a solo, doesn't matter if you are a solo practitioner or in a group, your data completeness is on how many patients you have.
Yeah, and
I don't know
and
if
I don't know
I'm
if I. Yeah, and I think for the last question, I don't know if I said like specifically like data completeness, but like in terms of like data, the more it's more about measurement in terms of like the more clinicians you have, the more you're able to measure performance.
Okay,
and which is similar like when you think about like the web interface.
Okay.
So like people, yeah, okay.
And last question is, I know that group under 10 can participate in the virtual group. If a provider leaves and another provider joins, and if there is still under 10, would the new provider who joined will become a part of virtual group, or no, he is out all year long?
So if a new clinician joins during the performance year, that new clinician would be part of the virtual group. And in the case you described, it would still be under 10. But let's say you were at 10. And let's say during the performance year, after you were already determined eligible to be part of the virtual group and you're part of the virtual group, let's say you're 10, hired another clinician, and now you're at 11, that's okay. And that 11th clinician will be part of the virtual group, assessed and scored as every other member of the virtual group.
Oh, so oncoming provider also starts becoming a part of virtual group.
Yes.
Okay, great. Thank you.
Great. Thanks,
You're
Emma.
welcome.
Your next question comes from the line of Mindy Yokelson.
Yes, hi. Thanks for taking my call. I was wondering if there's any virtual groups operating right now, or if any doctors are working to form one right now. Like how many are there, if any?
Yeah.
Well, what I will say, for 2018 performance year, in terms of, yes, we do have virtual groups operating, in which last year in 2017 they made an election and they are operating as virtual groups. Yes, we do have virtual groups.
How many are there approximately? Don't have to be exact, but
So Mindy, I'll jump in here. So we are working through our general analysis. We want to make sure that we're giving a complete picture of all the virtual groups that are participating right now. So that's why we haven't released any of that information. But as we complete that analysis, we want to make sure that we're providing all of you with accurate and beneficial information to really complete that picture of the virtual group participation option. We'll make sure that we get that out soon, but we are working on it.
All right, thank you.
Thanks.
Again, if you would like to ask a question, please press star, then the number 1 on your telephone keypad. We'll pause for just a moment.
I'm actually going to just take a question or two from the Q&A while we're waiting. Lisa Marie, I think we had a good question here just around the stage 1 and the stage 2. The question came from Mary Simpson. She was asking, in stage 1, does the TIN have to submit any of the same documents that they do in stage 2, or how does that process really work with documentation?
So for stage 1, it's more of information gathering. You don't necessarily need to submit an actual virtual group election. It's more of you being able to determine if you're eligible. So one thing that we know is like these TIN sizes may change, and if you want to know if at least your TIN size meets the criteria, you're actually able to contact these TA organizations to see what your TIN size is, or at least what information CMS is using in determining what your TIN size is, so you can assess, okay, do I even meet the criteria? What do I need to do? And it's basically to help you make decisions prior to actually making an election. So engaging in step 1 or stage 1 is to get information, like all those questions that I outlined, working through those, talking to those within the, let's say, TINs that you're potentially wanting to join with, seeing if you're even eligible in terms of, let's say, your TIN size. Because again, it's only TINs that are 10 or fewer can actually participate and join a virtual group. So stage 1 is, as I call it, information gathering. And stage 2 is where an actual election is made.
Fantastic. Thanks so much, Lisa Marie. We have just a few minutes remaining. I do want to check in on the line one more time. Do we have anyone?
We have a question from Lou Galterio.
Hi,
yes, hi. Had you on mute for a second. Thank you. I do have a couple of questions, but the most burning one I'll ask is something that was alluded to toward the end there by you, Adam. You mentioned that this could be a path to an APM, or can you elaborate on that? And in case I run out of time on my second part of the question, it's an easy one. If a provider chooses us as a proxy through the Identity and Access Management System that's used for PACOS, as long as we could show a contract, can we help the providers form a virtual group? Many of our providers, of course, are too busy, and over again, we take on the administrative burden for them on many things. This would be a good one. So the APM and can we form it for them with their permission as long as we prove it to you?
Sure. So let's start with that second one. Lisa Marie, can we have a proxy form a virtual group?
So I actually want a clarification on what you meant by proxy, because do you mean like the virtual group representative? So I just want to highlight that with virtual groups, we haven't established any provisions or policies that would restrict how a virtual group, or that they construct themselves. So virtual groups can identify the best way for them to coordinate themselves, how they want to structure themselves. The virtual groups have the flexibility to do those things. We don't put any restrictions on what a virtual group would have to do in terms of how they're structured or how they're coordinated amongst each other. Those are things that the virtual group can decide. Does that answer your question?
Yeah, that sounds pretty good. And we are actually in with a number of providers in a rural consortium in Florida, and a lot of providers would like to do this, but they're all very busy, and it does answer my question. There's also a system called the Identity and Access Management System for PACOS that you might want to look at, because they have the ability to assign proxies. But anyway, so how about the APM part, though? That's the real burning one on my end, anyway.
Yeah, and I think...
Go ahead, Adam. Go ahead.
No, I just wanted to kind of clarify, and I think what I was talking about at that point was with our technical assistance, we have the Transforming Clinical Practice initiative that's available, and these groups of support, so these are our support networks under technical assistance, our practice transformation networks, can help practices ultimately reach an alternative payment model or an advanced alternative payment model if that's something they're interested in doing. I wasn't necessarily trying to correlate the practicing in virtual groups with, a pathway to APMs, but I was just referencing that we do have the TCPI available for clinicians who need support, who are interested in participating in a virtual group and just need some support, but are also maybe interested in long-term in practice transformation and moving to an APM. Lisa Marie, do you want to add anything on?
No, thanks, Adam.
So, thank you.
Okay, thank you. Well, thank you all for joining us today. We do have to wrap things up. Again, please remember to mark your calendars for the beginning of the 2019 virtual group election period. It's coming up very quickly. And also, as we mentioned a few times throughout the call today, please help us spread the word about virtual groups. We're excited about this participation option. We're really kind of entering the second year of this being available, and we want to get the word out to clinicians and groups that this is available for them to participate in MIPS. So with that, thank you all again, and we'll talk to you again soon.